Joining us now is a panel of doctors who will be part of the Defeat the Mandates rally. Virologist and immunologist, co-creator of the mRNA technology, Dr. Robert Malone, chief medical advisor at the Truth for Health Foundation and the senior associate editor of the American Journal of Cardiology, Dr. Peter McCullough, and family physician, Dr. Scott Jensen. Doctors, great to see you all. Dr. McCullough, I want to start with you. Walk me through what the goal of this rally is.
The overarching goals are for America to hear the voices of doctors and doctors in a position of authority, that the use of vaccines is a medical decision. That's a personal choice. All the vaccines are still under investigation. They're still, in a sense, part of a large public health research program. And under no circumstances can they be mandated in any walk of life. It's all about a medical freedom of choice.
Dr. Malone, I asked you this off air before, and this is what I don't understand. We're now over 2 years into this pandemic, right? Why don't we have data on natural immunity? With so many people affected by COVID, why aren't we having the CDC or some other government institution, or frankly, some private hospital tracking how long natural immunity lasts?
That's a great question, Sean. I don't understand why the government hasn't done its job and why it hasn't forced pharma to do theirs. We have over 140 papers demonstrating the superiority of natural immunity relative to vaccines. And these vaccines do not protect against Omicron infection or spread.
Dr. Jensen, as a family physician, when people come in, what do you recommend? What do you recommend they take the vaccine? Is it by an individual case on an individual case? Like, how do you advise patients who seek you and seek your advice?
The bottom line is, if we don't have health freedom, we don't have freedom. I approach the COVID vaccine like I do other vaccines. I offer the patient the opportunity to ask me any questions they want. I share with them that if you look at the history of coronaviruses, we've seen antibodies come from natural immunity that are long lasting. I want my patients to know that when it comes to a vaccine, whether it be mRNA or any other technology, that it's their choice. It has to be. A vaccine elicits a specific immune response, and that's the same thing we do with chemotherapy. And none of us could imagine the government trying to tell us how to treat our prostate cancer or our breast cancer. We can't allow the government to tell us whether or not to take a vaccine.
Dr. McCullough, when you saw the people rallying today on the Mall for life, they were trying to target, you heard, the administration, Congress, right? That was their audience. Who's the audience for this rally?
The audience for this rally is really anybody in a corporate leadership position, government or educational leadership position that's actually been at the trigger of pulling the trigger for a vaccine mandate. They actually need to think through this very, very carefully. You know, Starbucks, a large company in the United States, just dropped their mandates across the board. The WHO has recently backed off on boosters. The UK recently has just dropped all kinds of various mandates regarding the pandemic. I think we should start to see a relatively rapid change in the boardrooms across companies and in the decision-making groups across education, government, and other walks of life.
You know, Dr. Malone, vaccines are really your world. Like, this is really your specialty. What makes the COVID vaccine, say, different than all of the other shots that we are told to get from the time that we're infants till adults?
Another great question, Sean. So these are unlicensed vaccines using experimental technology that has never been deployed at this scale before. The other vaccines that are mandated are well-established technologies. They are licensed. We know their safety and efficacy. In the case of these vaccines, those data are just not available. They're going to require years to determine the long-range effects, the long-term effects, and we don't know that. Mandating these experimental products represents the greatest experiment ever performed on humans in the history of modern science.
You know, Dr. Jensen, I want to play for you something. You know, there's a group of folks. Go ahead. I'm sorry, Dr. Jensen, I was going to say, there's a lot of folks who have some hesitancy for a lot of the reasons that were mentioned by the two aforementioned doctors. CNN's Don Lemon has called them idiots. Take a listen.
We have to start doing things for the greater good of society, and not for idiots who think that they can do their own research or that they are above the law and they can break the rules. Australia, Novak Djokovic, Australia said, no. We're going to look at the greater good of everyone in our society, and you're not part of that.
So, Dr. Jensen, I think you have a bit more medical experience than Don Lemon. Do you agree with his assessment?
I think Don Lemon is probably going to live long enough to rue the day he said something so silly. This really strikes at the heart of the Constitution. I think on September 9th, when President Biden issued his press conference where he tried to do an end run around congressional action, and then the Constitution smacked him down and said, no, excuse me, and the Supreme Court smacked him down and said, you don't get to do that to the Constitution. I think we're going to see this play out. We all feel the Berlin Wall is crumbling once again, and this time the Berlin Wall is a conventional established narrative as determined by conventional legacy media. It's crumbling. Don Lemon is going to rue the day he said that, because quite frankly, what we've been through has been a violation of the Constitution over and over again. And I think that's what the march has a lot to do with. It's about health freedom, because without that, we really don't have freedom. And people are waking up. We've seen hundreds of thousands of people demonstrating in European countries, and it's time for America to flex its muscles and say, enough is enough.
All right, doctors, we only have a few seconds left. But if someone can't make it to Washington, D.C. and can't make it to the march, give me your 15-second takeaway. I'll start with you, Dr. McCullough, that you would want somebody to hear you this weekend say.
The circle of medical freedom is inextricably linked to the circle of social freedom and economic freedom. We cannot let medical freedom be broken as a circle. Each person has their own autonomy over what gets injected into their body, and no one can put any pressure, coercion, or threaten reprisal of that sacred right.
Dr. Malone?
The science is settled. Omicron blows right through vaccines. It doesn't matter whether you're vaccinated or unvaccinated. You still get infected and spread. Don Lemon is wrong because the science is not with him. The vaccines are not working, and this is not a political issue. This is settled science. And the truth is that they're asking and seeking to force a product that is not effective. It is not completely safe. It is absolutely not effective, and it should not be forced on anybody.
Dr. Jensen.
If the last 2 years have taught us anything, it is that we have to begin to see the world through a different lens. And that lens is triangulated by big government, big tech, and big pharma. And what they've done to our assumed freedom will be the legacy of this COVID-19 pandemic. And we can never again become complacent in that regard.
All right. Doctors, thank you very much. And here's my one piece of medical advice. It's cold here in D.C. Bundle up. Stay warm, because I don't want you to get sick. All right, gentlemen. Have a great speech. Great weekend. Stay safe.
Thank you, Sean.